embed technology, which is now often used to divide communities, and to use it to unite us instead. So far, we've worked with local governments in Legazpi, Iligan, Intramuros, and Pasig. This year, we're working with Victoria City with the support and guidance of Mayor Javi Benitez. Mayor Javi, himself a young leader, has insight on the concerns that drive the youth in Victoria City. This topic and month-long survey collection and consultation will focus on a topic that concerns us greatly, mental health. We'll learn more about this during the mayor's keynote address, and we look forward to hearing what the youth think during the panel discussion later. So mental health is a very sensitive and important concern that we should give attention to. We at Makati Business Club are glad that this project will also be applied in that direction. We would like to thank Victoria City for partnering with us on this project. Before I turn the floor over to Mayor Javi, I would also like to express my thanks to Dr. Lito Diaz, Culture and Ethics Officer of the LGU, and Dr. Portia Malorca from the Academy. We're working hand in hand to provide you, the youth, with the mental health support you need. Finally, and most importantly, I'd like to thank all of you for joining us today. Turning over to Mayor Javi. Mayor Javi. Okay, perhaps Mayor Javi is having some connection issues right now. Maybe we can turn to him a little bit later on.
I think he's okay now.
All right, okay. Turning back to you, Mayor.
Hello?
Yes,
Is
we
it
can
good?
hear you.
Okay, thanks so much. So it is my honor as the Mayor of City of Victorious to welcome innovative and groundbreaking initiatives like the Digital Democracy Project run by the Makati Business Club in our beloved city. And it is a humbling experience to be selected as an LGU to receive the Digital Democracy Project. To the ones that put this together, I would like to thank the Makati Business Club, of course, headed by Coco Alcuaz, Executive Director of MBC, the Digital Democracy Team. I'd like to thank the panelists, of course, Dr. Joselito Diaz, Culture Ethics Officer, Jericho De La Cruz, a representative of Pag-asa Youth Association of Victoria City. I'd like to thank Taichi Ariel Capuno, Supreme Student Government Public Relations Officer of Negros National Science High School, Dr. Portia Mallorca of the DepEd Negros Occidental Division Superintendent, and the students, faculty members, that are available today. And I'd like to thank again Makati Business Club with Gita Keswani, Jid Abdurrahman, Cas Almares, Vida Aurora C, and Dara Golpe, of course. I wanted to thank you all individually for this. And we are very excited, the City of Victorious, that we are progressing towards a more digitalized system of governance. And what is better than using digital democracy to assert dominance over issues we are encountering in our own locality? With digital democracy, the government aims to gather feedback from more constituents, promote awareness through social media platforms, and enhance the spirit of collaboration between and among various units of the local government, and provide intervention services through helpline or hotline. When I ran on this platform that we need a cleaner, more efficient, and more inclusive government. And I've set on a path in the first 3 months to streamline the process and make it as digital and as modern as possible. And that we are already in talks with smart ecosystems for our city, and that we will see the fruits of it in the coming months. The importance of government support and policies to support the youth is to ensure that the welfare of the youth is looked into and given priority. It is about time that we hear the voices of the youth and that we bring them to the discussion table where policies, programs will affect not only in our present time, but for many generations in the future. Our youth is top priority, top of mind, and honing their mental health is paramount, if not, as it no longer remains as a household issue, but has evolved into a major social issue affecting the entire world, and especially during the pandemic and after, to the new normal. Today, we, in collaboration with the Makati Business Club and the Asia Foundation, will be conducting a citywide survey and online consultation focusing on the mental well-being of our youth. Presently, living in the age of technology where young people are equipped with IT skills, and due to the pandemic where social distancing is still imposed, the survey and online consultation seem to be the safest, most appropriate, and efficient means of communications or approach. It is vital that we use technology in crafting programs and policies for our government. In fact, data should be the center of decision making. When we make decisions, data provides evidence-based approaches towards crafting these programs and services. It should always be data-led. In the data presented by the provincial government of Negros Occidental, there are 261 suicide cases recorded from 2019 to April 2022. And from this data, 99 of them, or 38%, are teenagers. Also, among the 261 cases, 9 or 5% of that are Victorianos. We find the data alarming that in the local government should be serious enough in creating programs that will safeguard the well-being of the youth. When I was talking to the provincial government, they were talking about some cases that was quite sad, to say the least. It is because some of the cases of the teenagers that commit suicide, I'd like to share 2 cases. I won't say their names, but one of them is that there was a guy who broke up with his girlfriend and that he decided to end his life. And the other is that when this teenager was not doing well in school, the parents took his cell phone and he committed suicide. So this is one of the glimpses of how alarming mental health is today. Presumably, this depression and anxiety are among the many issues affecting Victorianan youth. However, the survey which will be conducted may provide government additional data to identify other mental health issues. The results will be used as a basis in understanding the severity of these issues and utilize these along with other evidence-based data to develop and design programs that can provide tailored solutions to address these concerns. Solutions that match citizen sentiment and are formed after civil discourse are considered. In the campaign, I mentioned that public consultation and participative democracy should be key. Because yes, data-based decisions are important. Yes, involving the youth is important in decision-making process. But the best is always involving everyone and having the true public sentiment. And I feel that this is one of the ways to do so. Going back to mental health, the city government is serious about this. And in fact, we, through the Office of the Culture and Ethics, have actually designed various mental health programs and services, such as mental health awareness, mental health assessment, and mental health intervention to tackle various types of mental health crises. Dr. Joselito Diaz, our Culture and Ethics Officer, will further explain the details of each program later. But in addition, we are in the process of formulating policies that will have a positive impact on the mental health care of our youth. Thus, we are calling on the Victorianan youth to participate. Your responses in the survey and discourse will play a crucial role in addressing this challenge. Let your voices be heard, and let us all work together towards a strong mental health. One of the top priorities of the campaign, when I campaign, and this administration is healthcare. And when we mean healthcare, we shouldn't only focus on the clinical side, which is also as important when we talk about increasing our facilities, improving our facilities, hiring more qualified and deserving doctors, nurses, medical professionals. We should also look at the preventive side. We should look at the nutrition of our kids, nutrition of our people. We should look at how mental health is not only something that is not talked about anymore, not something that is put under the rug, but something on the surface, and that's something that is being talked about in things like these. So let us work together, the City of Victorias, Makati Business Club, Age Foundation, and all the partners for this event, this opening assembly. Let us work towards a brighter future. And as we say in Victorias, masanyog na ta para sa masanag ang bus tamlag sa atong tanan. Good morning, everyone, and thank you again for this event.
Thank you, Mayor Javi, for that expression of support and encouragement for your youth constituents. Before we head on to the meat of this morning's event, we want to have a quick Zoom poll to break the ice. So in your respective Zoom screens, you should now be seeing our first Zoom poll. All you have to do is to choose an answer to the question. So asking, okay, here we go. So it's up right now. The first question is, what are you excited about right now? We have several options here. K-drama, hang out with friends, family occasions, school events, or your birthday. I think for me, I'm the most excited about K-drama. You could comment in the chat box below what K-drama you're watching. Pahingi na rin ng recommendation. Okay, so I see people are now answering the survey. And maybe now we can show the results. All right, so most people are excited about hanging out with their friends. I guess after a long COVID or quarantine period, we're very excited to see each other. Okay, moving to the next poll. Moving to the next poll. Okay, here we go. Next poll is what makes you the most stressed. So here we'd like to really talk about like what issues stress you out the most, or what issues are heaviest on your mind. We have schoolwork in the lead right now. Oh, parang ang bilis sumagot ng mga tao dito. Schoolwork talaga. Schoolwork is looking to be in the lead by far. Friend conflicts, barkada conflicts, relationship problems as the bottom. Okay, maybe we could show the results now. Okay, so we see that the most results are for schoolwork. That's overwhelming, 65%. Parang very stressful talaga ang mga Victoriano tungkol sa schoolwork. Okay, last, in the Zoom chat box, using any emoticon, please describe how you're feeling today. So unfortunately, this is just for those in the Zoom room. Maybe those in our Facebook chat could also comment it in our comment section. Okay. I hope everybody's feeling good today. I see some smiley faces. I see some comments here. Okay. Now I hope we're all ready for the meat of our event. We'll be having a fireside chat with 3 speakers. We have Dr. Vito Diaz, Victoria City's Culture and Ethics Officer, Jericho De La Cruz, a community-based youth leader representing PYAP Victoria City, and Taichi Capuno, student leader from Negros Occidental NFHS. I'd like to call on my colleague Vida to moderate the chat. Vida?
Thank you very much, Catch. So before we start our fireside chat, we'd like to advise all our attendees that our conversation may discuss some sensitive topics that may be difficult or uncomfortable for some to listen to. Okay, so maayong aga sa liwat, Dr. Lito, Jericho, and Tai Chi. Allow me to start first by asking Doc Lito. So Doc Lito, as the Culture and Ethics Officer, ano ang aton nga role or involvement sa mga mental health interventions sang aton nga City Government of Victorias?
Una sa tanan, mayong aga, Vida. And thank you for
Mayong
this
aga,
opportunity.
liwat, Doc.
I would like to greet our beloved Mayor. Mayong aga, Mayor, no? And to all the participants who are listening right now, especially student leaders from different public schools and private schools, mayong aga sa inyo tanan. So as to the question, ano ang role sa culture and ethics that we have in the local government unit in Victorias? So first and foremost, our office is a workforce under the headship of our beloved city mayor, Mayor Javi Benitez. And we are being mandated to look into the welfare of our workers, of our government servants, and to implement programs that will further enrich the skills and competencies of our government servants, for efficient and effective delivery of services to its constituents. And we are also mandated to design intervention programs for mental health that will cater not only the employees of the City of Victorias, but also for the youth. And we would like to use the media platform for its implementation. So later on, we will invite the teenagers, all the Victorianos, to visit the official webpage of Victoria City, because we will be plugging in and feeding you with beautiful and practical, helpful tips on how to make sound mental health.
Okay, thank you very much, Doc Lito. So, ara kagid gali sa frontline, sir, no, in terms of providing mental health support for our youth. So, to put things into context, Doc, how do we describe a mental health problem? Kag sa imo nga eksperyensya kag sa mga statistics nga nakuha naton sa city government, ano ini siya ka prevalent subong sa mga kabataan sa Victoria City?
Vida, actually, I would look at this in this perspective. We all experienced periods when we feel stressed, worried, sad, anxious, afraid, or angry. But I would like to inform you, my dear young people, that these are all normal emotions. However, when these emotions become severe enough that they interfere with the person's ability to function daily, and these feelings become persistent over time, then it can develop into a mental health problem. And when these emotions are left unchecked or untreated, or you're not doing something about it, you're not making your life healthy, then this mental issue or disorder can be chronic and long-lasting. And this can be associated with increased disability, and they impact daily functioning and frequently interfere with social life. Ang ambal ni Mayor Kaina, this will affect our social life, our family, and even your school work, my dear young people. So I'd like to mention the prevalence of suicide cases, as mentioned by our Mayor Javi, that in the province of Negros, Mayor is right in saying that we have 261 cases of suicide, and it is an overtime data. And this is being fed by the provincial health office to the city mayor's office. And that is why the city mayor, Mayor Javi, is urging us to really do something about and come up with certain interventions. So out of that 261, mostly are teenagers, because there are 99 teenagers from that 261, which is 38% of that figure, are mostly teenagers committing suicide. So it's quite alarming that we would like to look into this seriously. And we are also serious in coming up with some intervention programs, no, alongside with the participation of the teachers, no, and Dr. Mallorca as well in the future.
Okay, Doc. To recap, no, bali, as mentioned by Doc Lito, so start ang mental health problem as ordinary, kumbaga problema lang sa day-to-day, tapos wala siya yan na solusyonan kag until gadako siya and ga-affect na siya sa aton nga mga social lives, sa aton nga mga interactions with other people. So, subong naman, may ara din kita nga mga representative sa mga kabatanunan nga gusto taman pamatian sa subong. So, let me call on Jericho. Jericho, ano ang imo nga mga nakita nga mga common mental health problems sa imo nga mga fellow nga mga kabataan?
Una sa tanan mayong aga, no? Good morning. As a representative po ng Pag-asa Youth Association of the Philippines, Victoria's Chapter, the mental health issues that I saw na nakikita natin dito sa Victoria's as prevalent among my fellow youth are anxiety, stress, and depression, which usually leads to suicide po. According po sa latest estimation of World Health Organization, there are 154 million po people suffered from depression and 877,000 people died by suicide every year. And as a youth leader, this is quite alarming po, no? And knowing that the average suicide cases naman, as what mentioned by Mayor Javi kanina dito sa Negros, from 2019 to 2022 are reaching hundreds na po. And I think we need to take an action with regards to this issue. So yun lang po.
So, madamo gid nga salamat, Jericho, no? So it's also reassuring to know nga may ara din kita mga youth leaders ara sa komunidad nga ginatagaan din importansya kag atensyon ang mga gasalaka subong nga mga cases sa mental health. Subong naman gusto taman pamatian ang isa ka youth leader nga based naman siya sa eskwelahan or student leader. So, can we have Tai Chi? Tai Chi, ano ang mga nakita mo man nga mga mental health problems sa mga schoolmates mo, mga classmates mo, especially subong kay, di ba, gaamat-amat or gabalik na gid kita, gabalik na gid ang mga eskwelahan sa face-to-face na mga na set up. Kag ano ang nakita mo man nga mga posible nga contributing factors sa sini?
Good morning, everyone. It's such a pleasure and honor to be here today. So, to the question, I think it's difficult to generalize or focus on every mental health issue since all of us are battling our own demons and our own problems. But as an SS3 officer for several years now, I have heard many accounts from my schoolmates and my fellow youth regarding their experiences and their problems. Thus, I have observed that the most prevalent issues, or mental health issues rather, here in the youth are depression, anxiety, and panic disorders. The contributors that I believe have a part in the development of these issues are both social media and academic pressure. So social media has the tendency to highlight our insecurities. So sa mga social media platforms, hindi gid malikawan nga i-compare ta ang aton kaugalingon sa mga characteristics kag achievements ng iban nga tawo. So this could lead to low satisfaction with oneself. Sa social media, mayroon na sa mga nagdama na ginang participation sa ginatawag na cancel culture, or which is when people call out the problematic behavior of a person. Of course, this is also good since we call out improper behavior, but it has also led to the creation of a society that is irrationally sensitive and easy to judge. So as a teenager, it's also a big fear in us to be thrust out of social circles because of ignorant mistakes or misunderstandings. So this issue also needs to be addressed. And lastly, since gabalik na ang mga schools sa Victorias into in-person classes, the transition has not been easy, especially in schools that are academically rigorous, such as my own school, Negros Occidental National Science High School, it's difficult to maintain all aspects of your health and then also balance and have good grades and good academic performance.
Sige. So, Madam Idga, salamat tay Chino for sharing also what you have observed ang imo nga mga nakita sa inyo nga palibot or sa imo nga mga upod sa eskwelahan. So subong naman mabalik kita sa kay Doc Lito. Doc Lito, after nabatian ta ang mga gin-share sang representative sa aton nga kabataan, ano ang mahambal or ma-share mo man nga sabat or intervention halin sa gobyerno nga ginaplano ta to address these concerns ang aton nga mga youth?
Thank you, Vida, no? This is really a concrete response from the city mayor's office. We were called and to sit down and to come up with collective ideas on how we can respond to the situation. And in the city of Victorias, we are coming up with a mental health program through the use of media or online platform, where every Victoriahanon can have access in viewing mental health infographics, no, and helpful tips on how to build sound mental health. So these infographics will be uploaded twice a month, and this will cover all areas or aspects of person's well-being, such as emotional, psychological, intellectual, social, spiritual, environment, and economic. And we will soon start uploading these beautiful and practical mental health tips starting this month of September onward. And this will be done side by side by having this podcasting where there will be actual interview with experts in certain topics about mental health and well-being. So hopefully the result of the survey of NBC will also provide us with more data, no? So that we can also come up with more intervention. We can think of creative and innovative intervention programs and services to address the mental health issues of young people, particularly here in Victorias. So that's the mandate of our mayor that we have to work on, starting today onward.
Okay. Thank you very much, Doc Lito. So it's good to know nga may ara man sang i-look forward ang aton nga mga kabataan in terms of sa sabat or sa intervention man sang aton nga lokal nga gobyerno. So balik naman kita subong kay Jericho and Tai Chi after sang nabatian tano kung ano ang mga plano sang aton nga LGU in terms of providing mental health support sa aton nga mga kabatanunan. May ara pa ba kamo iban nga gusto niyo man makita nga programa or gusto nga mabaton nga suporta halin sa gobyerno? This is the time na kumbaga para mahatag niyo man ang inyo nga mga rekomendasyon sa aton nga lokal nga gobyerno. Jericho, would you like to go first?
Yes, ma'am. Thank you. Social support, I think. If there's something that we would like to get from the government, it would be social support. A support from the government that can provide more thorough trainings, seminars, and development to the youth leaders now, just like peer educators. I believe that empowering more peer educators in a certain community like Victoria City would be very vital in protecting and nourishing youth's mental health. It is quite different to have someone to talk to, someone to lean on who has the same age as yours, who knows how to assess situations and assist with care. In relation to this, World Health Organization defines social support as a crucial protective mechanism against depression and anxiety across ages, domains, culture, and risk factors now. And as of now, there are 30 active peer educators here in Victoria City, and under the supervision of Sir Ricky Lapidante, hoping that these numbers will increase and will continue to touch and inspire more Victoriahanons, especially the youngsters. Thank you.
Okay, thank you, Jericho. So sa kay Jericho, social support in the form of more peer educators. So how about kay Tai Chi?
For me, I think there should be a mutualistic relationship government and the youth or the students. Specifically, there is a need for more educational programs and symposiums such as this one, which is why I'm very grateful that there is a program like this one to Makati Business Club and then the local government. And then I also think that if possible, there should be free mental health checkups or mental health screenings in schools to avoid self diagnosis and to have students get the treatment or the help that they need. Thank you.
Thank you sa liwa Tai Chi, no? So sa kay Tai Chi naman, support in terms of free mental health checkups or maybe free mental health counseling. Probably pwede tayo masulod no sa aton nga mga eskwelahan, especially kay the face-to-face na kita subong. So para man sa iban nga kabatan-onan no nga ga-attend subong, kung may ara man kamo mga suggestion kag mga proposal nga gusto nyo man mapalambot sang aton nga lokal nga gobyerno, feel free gid nga mag-type sa aton nga chat box, or if gusto nyo man to remain anonymous, you can also message any of our co-hosts diri sa Zoom para if hindi ka mo comfortable to message it in public. And of course, gina-encourage ginamon kamo, as mentioned by Doc Lito kagina, gina-encourage ginamon kamo nga mag-send or mag-share sang inyo nga mga ginabati through the survey nga aton man nga i-open dugay-dugay. So with that, before we close our fireside chat, we'd like to hear a short closing message from our three panelists. For our youth no who may be undergoing or experiencing mental health issues right now. Doc Lito, would you like to go? Would you like to start?
Thank you very much, Ms. Bida. Although I mentioned that this is a mandate, but I think we have to do this because it is necessary and very important for us government leaders to act on it, no, and to do something with the situation. So, my dear young people, I know that we are living in a VUCA world, no? VUCA means vulnerability, no, uncertain. The situation is characterized with vulnerability, uncertainty, complexity, and ambiguous, no, because of the changes brought about by the pandemic, and we do not know, no, of what will happen next, no. But I think instead of looking at the situation as a threat, we have to look at it as an opportunity to be adaptive, to be resilient, to be innovative, and because new solutions will come in when we look at the situation as an opportunity to grow and to learn at the same time. Masakit tuod kagkabudlay sa sitwasyon tungod you are being asked to adjust in your school works, in your studies, but we just have to manage it. When things are changing and fear is getting stronger, we just have to manage these changes that are taking place. And good luck. The Office of Culture and Ethics is open for you whenever you need assistance, no? As mentioned by Mr. Jericho, you need to lean on, somebody to lean on. I am by profession a guidance registered counselor. Feel free to come and visit us here in the office. So, good luck to all of you and see you around.
Thank you, Doc Lito. Can we have Jericho for a short closing message?
If there's something that I would like to tell the youth right now, probably it would be an advice to start focusing more on ourselves, no? Embracing our flaws, accepting our imperfections, and start to practice self-love. Tagsa kita may kinaiyay. And try not to compare ourselves to others, no? Because as what Paulo Coelho said, all stress, anxieties, depression is caused when we ignore who we are and start living to please others. So let us please ourselves first. That's it. Thank you.
Thank you, Jericho. Now let's go to Tai Chi.
My message for my fellow youth who are facing mental health issues is to not be afraid to seek help if needed. Please reach out to your loved ones, your family, and friends, and do not be shy or afraid since this is the best defense against mental health issues. Also, surround yourself with things you enjoy and your loved ones, as well as all the other activities that make you happy.
Thank you very much to our three panelists, Doc Lito, Tai Chi, and Jericho. So, madamo gid kami sang nakuha kag nakatunan ng mga insights. So now, back to you, Catch.
Thank you. Thanks, Dr. Lito, Jericho, Tai Chi, and Vida for that engaging conversation. That was an interesting prelude to our online survey. Now we'll use a simple online form to understand your worries and concerns related to mental health. Don't worry, the survey is a safe space, so we encourage you to be as honest as possible with your answers. The more honest you are, the more it will help Victoria City create a mental health policy and interventions that can help you. It'll take 10 minutes. So on your screen, you can see a QR code which will lead you directly to the survey. Please scan the code on the screen. You can also click on the link that we'll be posting in the Zoom chat box. Before we move on, I'd like to quickly thank Mayor Javi Benitez for spending the day with us. Thank you so much for joining us today, Mayor, and we look forward and we thank you for your support. I think he now has to pop off for another meeting. So we'll see you, Mayor. Thank you very much. And we'll proceed with the program. So this survey, once again, is open to all young people of Victorias from ages 15 to 30 years old. So we invite all of you to participate and also to share the link to your schoolmates and friends. This will be open until October 5, Wednesday. Turning back to Vida to talk about the survey.
Vida, you're on mute.
Sorry. So, as soon as ma-open yun na ang survey, pwede na gid ka mo makasugod sa Batsini. So, please click on the link nga gin-post ang akon nga mga upod sa chat box. And for those who can also, you can also scan the QR code. Sige. So, don't worry kay dasig lang kag hapos lang gid sini nga survey. Next slide, Sir Felix. Okay, sige. So, i-run through ta ang survey no para clearer sa tanan. So, we'll start with, of course, our basic information, ang inyong ngalan, gender, age range. Nagdugang din kami sang field wherein ma-fill up kita kung ga-star, kung residente kita sa Victoria City or hindi. Tapos, ang inyong age range kag current educational status. So, mapili lang gid ka mo dira. So, next, our first statement will be, our first section will be indicate for each of the 5 statements which is closest to how you have been feeling over the last 2 weeks. So, kung diin sa mga, kung ano ang naga-representar sa kung ano ang ginbatsyag nyo for the past 2 weeks. So, ang aton nga rating system is 1 to 6. Ang 1 meaning wala biskan isa ka tinion, meaning wala nyo ginbatsyag for the past 2 weeks. Kung ang highest naman is 6, meaning sa tanan nga tinion. For the past 2 weeks, amo na ang inyo nga ginbatsyag. So let me run through the statement. So I have felt cheerful and in good spirits. Nagabatsyag ako kasadya kag kalipay. I have felt calm and relaxed. Nagabatsyag ako kakalma kag katawhay. I have felt active and vigorous. Nagabatsyag ako kapagsik kag kabaskog. I woke up feeling fresh and rested. Nagabugtaw ako nga presko kag tawhay ang akon nga pamatsyag. Last question. For this section, my daily life has been filled with things that interest me. Ang akon adlaw puno sang mga butang nga interesado ako. So again, mapili lang gid kamo for each of the statements. Sa kada statement, mapili lang kamo from 1 to 6. Next slide, Sir Felix. Okay. So next section, which of the following areas of your life stress you the most? So areas from 1 to 9 as the highest. Sige, so diri sa mga areas or sa mga aspeto sang inyong kabuhi ang nagahatag sang inyo sang pinakamataas na stress kumbaga. So rank these areas from 1 to 9 with 9 as the highest. So isend sang amon nga mga upod ang isa pagid ka link nga pwede niyo ma-access while gina-fix or ginakayo namon ang technical problems ang aton nga isa ka survey. Okay. So mabalik. Okay, so which of the following areas of your life stress you the most? So ara na ang link, ang alternate link para sa aton nga survey. So for this section, we need to rank them from 1 to 9 with 9 as the highest. 9 kung siya gid ang pinaka taas nga stress nga nahatag sang aton nga kabuhi. So kindly choose one response only per column. So wala kita sang tay-tay. Isa lang gid ka ranking per or isa lang gid ka aspect per ranking. So we have friends or ang aton amiga or amigo, family ang aton nga pamilya, other students at school, iban nga estudyante sang aton nga eskwelahan. It could also be iban nga pamatan-on sa online or other use online. Schoolwork, mga hilikoton sa eskwelahan. Can also be finances or kwarta. Physical health or ang physical nga panglawas. Romantic relationship or romantiko nga relasyon. Or it can also be work or for those nga working students or gaobra na. Okay. After that, the next question is, aside from the factors in the list above, are there other scenarios causing you stress and worry? So aside sa mga na-mention to kaginano ang 1 to 9 nga ginrank, may ara pa ba iban nga mga sitwasyon sang inyong kabuhi or parties sang inyong kabuhi nagahatag sa inyo sang stress or mga panumdumon? So ibutang nyo lang da, pwede man siya English, pwede man siya Hiligaynon, pwede man Tagalog. So again, aside from the factors in the list above, aside sa ginrank ta 1 to 9, ano pang iban nga mga sitwasyon na nagakahatag sa inyo sang stress and worry? Okay. Okay. Then if you are experiencing a mental health issue, okay, feeling anxious, depressed, or having suicidal thoughts, how likely are you to? So DND ang ano ang posibilidad nga obrahon mo ni. So not at all or wala gid daw hindi gid posible nga obrahon mo ni. So that is the highest sa aton nga ranking range until sa very likely or pwede gid. Okay. So ang aton nga statements, talk to a friend, o mastorya sa inyong miga or migo. Talk to family, mastorya sa inyong pamilya. Talk to our teacher, mastorya sa isa ka maestra or maestro. Consult a mental health professional, magpakonsulta sa isa ka professional or eksperto sa ikaayong hunahuna. Or check online resources, mangita impormasyon sa internet. Next slide, Sir Felix. Okay. So, ari naman, kagina if kamo ang gaka-experience ang mental health issue, ari naman nga part is once nga, kung may kilala kamo nga gaka-experience siya mental health issue, feeling anxious, feeling depressed, or may ara sa mga suicidal thoughts, ano ang posibilidad nga obrahon nyo ang mga actions ini? So, Same lang ang aton ranking system, not at all or wala gid or hindi gid siya posible. And the highest is very likely. So amo gid na ang laban-laban, amo gid ang obrahon ta. So aton nga statements, tell his or her friend, mastorya sa iya amiga or amigo, tell his or her family, mastorya sa iya pamilya, tell his or her teacher, mastorya sa isa niya ka maestra or maestro. Consult a mental health professional. Magkonsulta sa isa ka professional nga eksperto sa ikaayong hunahuna or mag-check online resources, mangita impormasyon sa internet. So again, this question is about ano ay ang posibilidad nga obrahon mo ni kung may kilala ikaw nga gaka-experience sang mental health issue. Okay. The last question is, what mental health intervention from the government do you want to be implemented? So same man is again question ta kagina during the fireside chat, no? So ano pa nga mga intervention, programa or solusyon halin sa government ang gusto niyo makita nga i-implementar? Sorry, wala ni siya limit sa kung pila ang inyong i-check or i-answer. So awareness campaign, kampanya sa pagpasanyog sa ihibalo tuhoy sa ikaayo nga panghunahuna. Counseling, paghatag sang paglaygay. Support group, suporta sa grupo. Or also social group, no, sa na-mention kagina. Crisis hotline numero nga pwede makontak sa tion sang crisis, therapist or terapiya, or others. Kung may ara sang wala na mention sang aton nga options, you can type it here sa aton nga others. Then you can just type kung ano ang inyong assumption. So amo ina ang aton nga survey. Sir Felix, next slide please. So once again, gina-encourage ka mo namon nga i-share pa ini nga survey sa iba niyo pa nga mga fellow nga kabatan-unan. So open ini until sa October 5. And as mentioned by Dr. Lito, the more nga may magsabat, the more nga magsabat sang amon nga survey, the more nga mas mabalaan sang inyo nga gobyerno kung ano ang ilang nga dapat obrahon para makahatag sang mental health care support sa inyo nga mga kabatan-unan. Back to you, Katch.
Thank you, Vida. Formally close our event and to further encourage you all to participate in the survey. We'd like to call on the DepEd School Division Superintendent for Victoria City, Dr. Portia Malorca. Dr. Portia has been instrumental in inviting all of the participants to today's event, and she made sure that all of you are here today. Dr. Malorca.
Good morning, Ms. Kat. Good morning, Vida. Good morning to our Honorable City Mayor, Honorable Javi Benitez, Doc Lito, to all the panelists. We have Sir Jericho and also Ms. Taichi. We are indeed very grateful here in Victoria City that our mayor is giving top priority on education, most specifically on the mental health of our youth. When Mayor Javi first approached me during our school board meeting about this digital discovery, I was so excited, more than excited, when I was first informed that I will be assigned in Victoria City. And so working with our city government and working with Makati Business Club and Asia Foundation, we are indeed very grateful. To our participants, our DepEd public secondary school leaders, and also our private secondary school leaders, we are glad that you all here in this virtual event. What first caught my attention was the first two questions which were posted for you. What were you most excited about? You said it's going back to school. And what stressed you most is also the schoolwork. Then I say, well, you really want to be stressed. But it's not what we want with DepEd. What we want with DepEd is to provide you with accessible, quality, and relevant education. And so, for a start, this school year, I'm very glad to inform all our followers and attendees today that in DepEd Victoria City, we are now 100% in-person classes. And we have prepared for this, not just the physical school setup, but our lessons for the first 2 months as well. So DepEd provided the psychosocial support activities, which complements the target for the mental health issues somehow. And we are also moving on forward into providing the bridge. We call it the invigorating learning prowess for our children. We realize the gap, the learning loss, the learning gap that our children are facing this year. Just imagine 2 years when they were away from school and now they're back. So we have to provide a bridge. We cannot just let them plunge into this river of VUCA world, according to Doc Lito. And so to our student leaders, I also take this time to congratulate all of you for being the newly elected sets of our Supreme Student Government Officers. Because as scheduled, you made it. And soon we will be organizing our federated SSG organization. And I mentioned this because as elected officers, you have a bigger influence over your peers. They trust you, they have confidence in you. And that means they will believe what they see in you and what they hear from you. And so with this mental health assembly, with this the result of this survey and the outcome of this, which would be the policies for the youth, specifically in Victoria City, we look forward into improved and enhanced desirable values among our youth. I remember when I was also a youth, because I belong to the baby boomers gen, so I remember the 4-H club. It's about the health, mental health, which is the head, emotional health, which is the heart, physical health, which is the hands, and then the totality of it, it's the health in all, the head, the heart, the hands, and the health. And so I was looking at it when Mayor Avi mentioned earlier in his message about mental health, what do we feed our head? Because Mayor also mentioned about nutrition. And if you want to be physically healthy, you want to eat healthy foods. But if you want to be mentally healthy, you also have to feed your head or your mind or your brain with healthy ideas. And so with the modernization of our approaches, modernization of learning styles through technology, through this digital democracy, there also goes with it the modernization and mutation of illnesses. As mentioned also by Ms. Taichi, there's that social media illness. So there's a choice for you. Are you going to choose to feed your mind with healthy issues or with ill issues? So to you, my beloved students in Victoria City, thank you that we have this assembly. And may what we get out of this will really be shared. I was listening intently to your discussions. At the bottom of this all, we need also to communicate. Just like what Doc Lito mentioned and also Mayor mentioned, that in Victoria City, the Victoria's Information Office, we will be posting infographics, but it will stay there if you will not go there. So like what we did before in DepEd, we ask the children to go to school to have education. But for now, we will bring the school to you. So with our city culture and ethics office, with Doc Lito, we will work hand in hand with you. We will bring to our learners, we will bring to our youth this healthy input, this infographics that will lead them
Okay.
to develop mental health. Thank you so much.
Thank you, Dr.
God bless
Portia, for
everybody.
your support.
Mabuhay ang Victorian.
Yes, thank you, Dr. Portia, for your support and your presence in today's event. So to all of the youth of Victoria City, keep your responses coming. The survey will be open until October 5 Wednesday. Now it's time for our photo op. We ask everybody to turn on our cameras. I'll count 2 times. So 1, 2, 3, smile. 1, 2, 3, smile. Okay, to our participants, once again, please share the survey with your schoolmates, friends, and organization members. We'll send you the link via email, and you can also find it on our Facebook group. The survey will be open until October 5. We'll process the results and come back here to present them to you. We'd also like everyone to follow us on social media. Our handles are being shown on the screen now. With that, we look forward to seeing you at our closing event on October 5 Wednesday. Stay safe and have a good day. Madaamo, gid nga. Salamat!
Thank you, everyone. Thank you, Dr. Mallorca.
Bye-bye.
Thank you, Doc Lito. Thank you, Jericho. Thank you, Tai
Thank
Chi.
you so much.
Jill, Kat,
Vida, Doc Lito, thank you.
Thank you.
Thank you, Doc.
Thank you!
Thank you, everyone.
So, Vida, bye-bye.
Thank you, Jericho. Thank you, Tai Chi.